Hey guys, my name's Sam. Welcome to PrepMedic. This week we are in the White River National Forest at Budge's Hunting Lodge talking about medical kits for hunting. So hunting, especially hunting in the backcountry, carries with it some very unique risks. Here at Budge's, we've got a lot of livestock that they're using to transport people back to different drop camps. We are probably 2-3 hours away from the closest hospital by ground, and it just brings up a lot of different risk factors, especially when you factor in firearms, bows, and all sorts of other accidents that can happen here kind of in the middle of nowhere. So X-Year, myself, and Trauma Pack have come together to put together a hunting kit for Budge's Lodge. We've donated a number of these to their guides, and we really took into consideration some of these unique threats. I'm going to go through it today and kind of talk through what we decided to put in this kit. Obviously, it's not all inclusive. There are definitely things that other people might put in or take out. It's really dependent on your situation and what area you're in. So the base of this kit is the Stronghold Deputy by Trauma Pack, but we've added a lot to it. The case itself is kind of inconsequential. This one has MOLLE attachments. That's probably not needed in a lot of these situations, but it holds everything we need, which is why we went with it. Just make sure that whatever kit you're putting your supplies in has easy access to your life-threatening items such as your tourniquet and your packing gauze. As we look on the outside of the kit, we have a tourniquet on the outside. Now, we're using the Sam Medical tourniquet specifically because a lot of the guides out here, they're guides first. They're out here every day. They are not healthcare professionals. So this gives you a really good tactile feel when you've done that initial tightening tight enough to occlude blood flow and you start turning the windlass. So this tourniquet has a lot of benefits to that. I've found it's really great for training as well, just because it gives you that click and locks the strap in place when you're applying it. So the other benefit to this is the metal windlass, which is going to be a little less affected by some of the adverse elements of the outdoors, especially when it gets into winter. As we come into the kit, open it up here. This has a rip open function, so it's all pretty easy to get at. We've got your contents of a regular IFAK that you're probably used to seeing on this channel. So right here in the life threat section, we have a thing of quick clot combat gauze for packing junctional sites if you have a massive arterial hemorrhage and that's not amenable to tourniquet application. Similarly, and kind of as a backup to that, we've got one thing of NAR S-rolled gauze. Once again, it will fulfill that role for packing a wound. If you have multiple wounds or if that one's not quite enough gauze, you can start packing this on top of it. You can also use this to wrap different things. You can use this for kind of a makeshift pressure dressing if some of the other items in this kit aren't working out for you. Now, hypothermia kills and trauma, so we have a space blanket here. Like I always say with these, you do have to insulate under them. These are not going to keep somebody warm in and of themselves, but when we have somebody that has lost a lot of blood, has a lot of injuries, whether those are external or internal because they just got kicked by a mule in the gut, they lose the ability to clot when their body temperature falls below 95 degrees. So even on a really warm day, we're going to want to have space blankets on our patients and treating for hypothermia. Now, they did include Trauma Pack's card. This is kind of a quick instruction manual for how to assess and treat a patient. It doesn't really go into details. The back doesn't really apply at all. It's for an active shooter, which I'm assuming we're not going to have back here in a wilderness area. Now, up in the top of the pack, we've got two pressure dressings or elastic bandages. More specifically, and these can be used for a variety of different things. Somebody sprains their ankle, it's really, really easy to wrap their leg. Like I said, we're about 3 hours from the closest hospital. It's going to take responders a long time to get back here. If helicopters can't fly because of weather, we're going to need to hike somebody out of this lodge, out of this area. So this will allow us to secure something to the foot. So we might just wrap it by itself, or we might use something as a makeshift splint. There's not quite enough room in here to carry Sam's splint, but that is something I'd definitely add to this if we had just a little bit more room in there. So we've got two of these, and then these can also be used to wrap in your junctional site gauze. So if you have packed a wound, you have to start moving them. This is a great way to secure that once you've held it for at least 5 minutes for the hemostatic agent or at least 15 minutes with the packing gauze itself. So in the same line as life threats, we have a pressure dressing. Now this is actually like a trauma dressing. So this has a pad on it. It's meant to apply some pressure to a bleeding site. So if you have like a cut on the leg, the arm or the head, it's not life-threatening bleeding. We don't have to do any drastic measures, but it is something we need to cover up and stop the bleeding. This is a great option for that. Those head wounds bleed a lot. So it's really nice to have something like this to stop that blood flow. They can keep their eyes clear and continue about their day. Now we have chest seals, which chest seals, you know, might on the surface seem like something you're not going to need hunting, but once again, we're dealing with firearms. There's a potential for negligent discharge. And then there's also the potential for getting a stick on the trail. You know, there's some people in our party here that have actually seen people impaled with sticks riding dirt bikes. The same thing can happen on horseback. You know, if they bolt or they spook through the woods, you can get an impaled object in the chest that can cause a sucking chest wound. These can also be used just to seal different wounds. If you're packing a neck, you're going to want to throw a chest seal over that packing just so it's not sucking in air and causing an air embolus in the brain. Next up, X-Shear actually threw in some of their trauma shears. You know, we're not dealing with light clothing out here. I'm probably dressed the lightest out of anybody. We've got really thick Carhartt coveralls, especially when, you know, Rifle 2 comes around and there's a foot of snow on the ground, people are staying warm. You're gonna have to get through a lot of different clothing, especially the guides. You know, they're out here every single day dealing with these animals and they're probably at the highest risk of getting hurt. So having something that can cut through those clothes is super important. So these X shears are included and thrown in the kit. I'd recommend having something that can cut through very heavy duty clothing when you're looking at, you know, hunting in general. Now up here's some just kind of other items: duct tape, Sharpie, and your PPE. Those don't really need a ton of explanation. And last but not least, we have some of the more hunting specific items. This is kind of the boo-boo pack in this entire kit. So in here, we've got paper tape. With the tape, you can obviously buddy splint your fingers. So if you have a broken or dislocated finger, you can splint them to each other. It's gonna reduce pain and help that healing process if you aren't able to get to the hospital right away. Now, we've got a couple other things. So signaling is a big deal in the backcountry. Now, we could throw a lot of flagging in one of these kits. I'd recommend you carry something bright orange on you that you can flag, but just as kind of a contingency or a backup if your Garmin inReach isn't working, there is a signaling mirror in here, and this will allow you to, you know, flashlight towards an aircraft or to ground rescuers, just help them locate you. Another consideration you guys could take into account is an auditory signal of some kind. Obviously, that's not going to attract an aircraft, but if you are able to see ground searchers or you're trying to help people triangulate your position, having some kind of whistle would also help in that process. We've got some Advil, just some OTC meds to deal with, you know, your aches and pains. We were all on horseback for about 8 hours today, and we all have some aches and pains on us. So having some of these is great. And then we've got some Q-tips to get things out of the eyes, your run-of-the-mill Band-Aids. And last but not least, we've got steri-strips and tegaderms. Now, steri-strips are a fabric strip that you can put over a gaping wound to kind of close that up. It limits the risk of infection. It also will help it heal and have a little less scarring when that does occur. It's not necessarily a replacement for stitches, but sometimes you're just not able to get in 4 stitches in the time frame that's required. So these are great to have. Now, if you get a gaping wound, you know, obviously you want to debride that. You want to clean that out as good as possible. There is triple antibiotic ointment in here as well. Throw the steri-strips on, close that skin, and then the tegaderms come in. So the tegaderms are going to act like a secondary skin and allow you to put it over those steri-strips. It's going to keep those steri-strips from coming off. It's also going to keep dirt and other contaminants from getting in. So that's really going to help you in the long run. So while this kit is primarily made for your major life threats, your major bleeding, your penetrating trauma, we also felt it was important to put some of these minor items in, things that aren't going to necessarily force you to go to a hospital right away. They're not going to kill you, but they are going to be a detriment to your experience out here and could lead to long-term problems if you don't have a way to treat them. So I'd like to hear what you guys would throw in a hunting kit. Like I said, obviously it's going to change by region. If you have any questions, leave them in the comments down below, and I will see you next week.